It's Joy King, and today we'll be doing a head-to-toe assessment on Miss Keandra. Before this, I previously assessed Miss Keandra's vital, height, and weight. I assessed her vision using the Snellen chart, and her vision was 20/30, meaning that at 20 feet she can see what the normal eye can see at 30. She was alert and oriented times 4. She was dressed appropriately for the weather, and her speech was clear. As I enter her room, I will have already done my hand hygiene, and I will provide privacy. Hello, Miss Keandra. My name is Joy King. I'll be your student nurse for today. Can you please give me your date of birth, please?
March 1st, 1993.
Perfect. Okay, we're going to begin a head-to-toe assessment today, but before we do that, I'd like to get some neurological tests out of the way, so we don't have to worry about that in the physical part.
Okay.
The first thing I'm going to do is I'm going to have you close your eyes. I'm going to occlude one nostril at a time, and I want you to tell me what you smell.
Alcohol.
Sorry if my hands are cold.
Alcohol.
Perfect. That means that cranial nerve 1 is intact. We previously assessed your eyesight using the Snellen chart. Your vision was 20/30, meaning at 20 feet you see what the typical eye can see at 30. That means that cranial nerve 2 is intact. Could you raise your eyebrows for me? Okay. Now I want you to follow my pen light with your eyes. We're going to do the cardinal points of gaze. Perfect. That means that cranial nerves 3, 4, and 6 are intact. Alright. The next thing I'm going to do is palpate your teeth. This is your temporal mandibular joint. Can you please open your mouth for me? Move it side to side. Close it. Now hold it against my pressure. Alright, that's good. The next thing I want you to do is I want you to close your eyes and tell me when you feel my touch.
Yes.
Okay. That means that cranial nerves 5 and 7 are intact. The next cranial nerve is going to be testing some of your hearing. First thing that I'm going to do is I'm going to do the Weber test. I'm going to hold this, start the tuning fork, hold it up above your head, and I want you to tell me if you hear it equally in both ears or more in one and less in the other. Okay?
Equal.
Okay, okay. The next thing I'm going to do is called the Rene test. I'm going to look at the clock on the wall. I'm going to strike my fork and hold it up against your mastoid process behind your ear. I want you to tell me when you stop hearing that. That tells me your bone conduction. Then I'll hold it in front of your ear, and I want you to tell me when you stop hearing that as well. And that will be your air conduction. Okay.
Right. Yeah.
Okay. That's very good. That means that your air conduction is twice as long as bone conduction, which is normal, and it's what we're looking for. The next thing I'm going to do is I'm going to go behind you, and I want you to close one of your ears. It doesn't matter which. I'm going to whisper something, and I'd like you to repeat it back to me.
Okay. 1, 2, 3.
Very good.
ABC.
All right, and that was the whisper test. All those tests combined mean that cranial nerve 8 is intact. Next thing that we're going to do is it's going to be a cranial nerve test of the nerves that control the mouth and speech. Can you stick out your tongue for me? Okay. Can you say ah? Okay, uvula and mid and soft palate rows equally. The next thing that we're going to do is can you say light, tight, dynamite?
Light, tight, dynamite.
Okay. I need to test your gag reflexes. Okay, that was good. And then can you close your eyes and stick out your tongue? And tell me what you taste.
Salt.
Try it one more time.
Sugar.
That means that cranial nerves 9, 10, and 12 are intact. All right, the next thing we're going to do is going to be the cranial nerves that control muscle movement in the shoulders and the neck. I'm going to hold down your shoulders, and I want you to press up against my resistance. Okay, and then with your head pressing against my resistance. And again. All right, cranial nerve 11 is intact. The next thing I want to do is going to be rapid alternating movement. This is going to test your fine motor control. This isn't a cranial nerve test. I just want to see how well your motor function is. So starting with your thumb, I want you to go to each finger, alternating. Go a little faster. Very good. All right, the next thing I'm going to do is going to be a couple tests called stereognosis and graphesthesia. If you will close your eyes and hold out your hand, tell me what I'm drawing on your hand.
8.
Yes, ma'am. All right, keep your eyes closed. I'm going to place something in your hand, and I want you to tell me what it is.
A coin.
Very good. Graphesthesia and stereognosis was normal. Now I'm going to go ahead and begin the physical assessment. First thing I want to do is I want to assess your skin. Your skin is warm. There's no erythema, jaundice, or pallor. It is even bilaterally. It is appropriate for your genetic background. I don't see any massive lesions or abrasions. Next thing I'm going to do is move on to your head. And if you don't mind, I'm going to palpate your head. I'm just assessing for any lumps, lesions, or masses. I don't feel any. I don't see any parasites in the hair. The hair is evenly distributed and it is black. Okay. Your head is normal cephalic. It's equally, it's midline and erect, and it's rounded and symmetric across all regions. Right, the next thing I'm going to do is I'm going to assess your eye, and what I'm going to do is I'm going to pull down right here. Your conjunctival sacs are pink and moist. The lacrimal ducts are pink and moist. I don't see any abnormal discharge. Your eyelashes are evenly distributed, no entropium, no extropium. Palpebral fissures are present and symmetrical. I don't see any lid lag. I'm going to palpate your sinuses. These are your frontal sinuses. Any pain or tenderness?
No, ma'am.
Okay. And then your maxillary. Any pain or tenderness?
No, ma'am.
Okay. Now we're going to do a few eye tests. First one I want to do is a confrontation test. I want you to hold this over one of your eyes, and I'll hold it over my eye. And I want you to tell me when you can see this in your peripheral.
Okay.
And we're going to be looking at my pen light.
Okay.
Stare straight at my nose.
Mhm.
Okay.
Okay. Yes, ma'am.
All right, leave it there.
Mhm. Mhm. Mhm.
Okay. For the sake of time, I'm not going to repeat it in the other eye, but normally I would. Okay. Next thing I'm going to do is I want you to look straight at my nose again. We're going to do this called the cover test. I'm just testing to see if your eyes move when one is covered and the other one is not. Okay. Good. Good. No knife guidance or your business. That just means that your eyes don't deviate at all from the norm. And you do the corneal light reflex. If you'll just look at my nose again. I'm checking to see if the light reflects in both eyes equally. I do see the reflection in both eyes equally. That's very good. I'm going to test your pupils for reactivity to the light. So just look straight ahead for me. Your pupils were equally round and reactive to light. I'm just going to see how large your pupils are. Pupils are approximately 3 millimeters. That's very good. Next thing we're going to do is an accommodation test. And I've drawn a little dot on the wall. You'll just look at it. And then when I count to 3, I want you to look at what I place in front of your eyes. Okay? 1, 2, 3. Very good. Your eyes accommodated equally. That means that your eyes are perla, which means that your pupils are equally round and reactive to light and accommodation. That's very good. Okay. And then one last thing on the eyes. I'm going to look inside of your eyes. This won't hurt you at all. It's going to shine a bright light. What I'm looking for is that red reflex that we sometimes see in pictures. I'm just making sure that it's there.
Okay.
Come at a 15-degree angle. I do see the red reflex. I see the cone of light. It's cream yellow. I see retinal arteries and veins present and equally paired. Very good. Once again, for the sake of this video, I'm not going to go to the other eye, just for the sake of time. I think we're done with the eyes. The next thing I'm going to do is we're going to move on to the nose. Okay. Nose is midline, symmetrical. Both areas are symmetrical bilaterally. I don't see any lesions or abrasions on the outside. I'm going to do an internal examination of your nose now. Okay. Once again, this isn't going to hurt at all. I need you to lean your head back while I look inside. Nasal mucosa is pink and moist. Turbinates are present. I don't see any edema or swelling on the turbinates, and the septum is not deviated. Okay. The next thing I need to do is I'm going to move on to the ears, and I'm going to begin that by palpating. Tell me if you feel any pain or tenderness. Okay. Palpate the auricle. Any pain or tenderness?
No, ma'am.
Palpate the pinna. Pain or tenderness?
No, ma'am.
Tragus.
No, ma'am.
Mastoid process.
No, ma'am.
Right, very good. I'm going to do an internal examination of the ears. And pull back slightly. You'll feel some pressure. Oh, I see the interior of the ear. There's no excessive rumen accumulation. There is no excessive drainage or swelling. I can see the cone of light at 7 o'clock. I also see the tympanic membrane. It's pearly gray. No eversion or inversion. No bulging. No swelling or abrasions upon it. I see the umbo, the malleolus, and the manubrium. So again, once again, for the sake of this video, I'm not going to move to the other side. Okay. Now I'm going to do an oral examination, but first I'm going to start with the outside. Okay. Lips are moist and pink, no cracking, no lesions or swelling, none on the outside. You will open your mouth. And look inside. Okay. I see the buccal mucosa is pink and moist. Hard palate is white, soft palate is pink. I see the posterior pharynx and those pillars are both symmetric and pink. Tonsils are present, 2+ with slight crypts. I see your steps and stuff. Your dental hygiene appears to be very good. I don't see any dental caries. Teeth are white, all present except for the wisdom teeth. Can you lift up your tongue for me? Frenulum is present in midline. I see the Wharton's ducts, and the oral mucosa underneath is pink and white. Okay. Should be it with our oral examination. Next thing I'm going to do is I'm going to palpate your lymph nodes up and along your neck, along your jaw. They shouldn't hurt at all. If you feel any pain or tenderness, please let me know. We're going to start with our preauricular, postauricular, occipital, submental, submandibular, tonsillar, superficial cervical, deep cervical chain, posterior cervical, and supraclavicular. Any pain or tenderness? Okay. Next thing I need to do is I need to assess your carotid arteries. I'm going to go one at a time. Okay, carotid artery is 2+ on, and carotid artery is 2+. They're both equal. That's very good. Can you lift up your neck for me? Trachea is midline, no massive lesions or abrasions. I'm going to go behind you and I'm going to assess your thyroid. All I need you to do is lean forward for me. I'm going to palpate your neck. Turn your head forward to the right and swallow. Very good. To the left and swallow. Okay, I didn't feel any masses. Thyroid is not palpable and that is normal. Now I need to get my stethoscope. I'm going to auscultate your carotid artery as well. I do this using the bell of my stethoscope. Sounds good and strong, regular rhythm, and I didn't hear any breathing. So give me just a second. I'm going to check my notes to make sure that I haven't missed anything with the neck and head assessment. Okay.
Now we're going to go ahead and do a look at the internal portion of your nose. That's good. So you just lean your head back for me. Okay. Your nasal mucosa is normal red, moist, smooth. Your turbinates have no swelling, excessive discharge, or bleeding. Your nasal
I didn't know that your skin turgor.
Appear to be symmetrical with one another. We're going to
Alright,
palpate your ear.
You have very good skin turgor. Your skin is elastic. That means that you're not dehydrated. I also didn't note that the sclera of your eyes is white, and that your eyes are both equal symmetrical, and that there's no protrusion of the eyeball. Alright, now we can move on. First thing I want to do is I want to listen to some heart sounds. There's going to be 4 different places I'm going to listen to. The bottom 2, of course, will require you listening for sure. Are you comfortable with them? Mm-hmm.
Now, I don't see any excessive drainage.
I'm beginning with the aortic valve,
I'm going to go a bit further.
right sternal border, second intercostal space.
Your cone of light is located at 7 o'clock position.
Pulmonic is left sternal border, second intercostal space.
Great. I don't see any retraction or bulging noted.
You lift up your shirt.
There's normal finding.
Mm-hmm.
Next, I'm going to perform
Tricuspid,
a hearing test.
left
First, I'm
sternal
going to
border,
perform a
fifth
whisper
intercostal
test. I'm
space,
going to stand behind you, and I want you to hold
and
one ear,
mitral.
and I want you to tell me what you hear me with.
Left side is midclavicular line, fifth
Right.
intercostal.
Over here.
Okay, they all sound very good. I heard S1 and S2 sounds. I didn't hear
Whipper test. What I'm going to do is
any additional sounds in the heart, and I didn't hear any murmurs. Next thing I'm going to do is I'm going to auscultate for lung sounds.
Okay.
I'm going to start at the front and then move to the back. Every time you feel my stethoscope, I just like to take a deep breath.
This time I'm going to place on your mastoid process. I want you to tell me when you can no longer hear it, and then I'm going to move to the front of your ear canal. I want you to tell me you can no longer hear it. Great. These 2 tests tell me that, or all these tests tell me cranial nerve 8 is intact. That last test
Very good.
indicated to me that you're able to do your air conduction longer than you were able to
Once
do
again, when you feel my stethoscope, take a deep
this again is normal. Next, we're going to move on to your eyes. See no obvious lesions or abrasions on your eyes. I'm going to check your lateral ducts here, make sure there's no swelling. Okay, I don't see any swelling. Now, I want you to lift up for me. Look at your conjunctiva and your sclera. Okay, your conjunctiva is normal. It's pink and moist. Your sclera is china white. Now I'm going to perform a few eye tests. We have previously already done the selling.
Lung sounds are clear across all fields. I hear no adventitious sounds, which is very good. The next thing I'm going to do is I'm going to percuss your back. You can turn it to the side for me,
Now
please.
we're going to do a corneal light reflex.
Which shouldn't hurt at all. Alert me if you feel any tenderness.
Okay, now the light did reflect off your cornea in the exact same spot, and this is what I was looking for. So now I'm going to perform a cover test. I want you to fix your gaze on my face, and I'm going to cover one eye up, and I'm checking to see if you have any deviation. Okay, ready? Okay, your gaze was steady and fixed, and I did not see any deviation. Now I'm going to perform a confrontation test. What I want you to do is cover up one eye, and I'm going to cover up that same eye, and I want you to tell me when you can.
Okay, I heard company throughout, which is very good. I heard no dull notes. And now I'm going to do CBT test. You're fine. You can do that one.
I'm sorry.
Oh, you're fine. Alright, I want you to alert me if there's any pain or tenderness. What we're doing is we're assessing the kidney, the tenderness.
So now
No,
I'm going
ma'am.
to test your
Very.
eyes.
You can turn
I'm going
back.
to do position, eye contact test. I want you to focus on my pen,
Okay.
and without moving
And the
your head,
next thing
move your
we're going
eyes.
to do is we're going to assess your abdomen. If you would just lay back for me.
Alright, your eyes did move parallel with one another. This tells me that
Hey, just look at the shirt for me.
6 are all intact.
First thing we're going to is
So
this
now
back.
I'm going to test your pupils for
Stomach
light
is
reaction
flat.
and
Umbilicus
accommodation.
is inverted. I don't see any masses, lesions, or abrasion. I'm going to start by listening to your abdominal sounds.
Focus on my pen line. Okay, your pupils
Alright.
focus equally and distribute symmetrically.
And start from
Now,
the
I want you to do
lower
again,
right
push your
quadrant.
gaze behind me. I'm going to shine a light in your eye, okay? Okay?
upper
Again,
right.
focus your gaze behind me. Alright, great. Now, your pupils dig
Upper left.
straight symmetrically. This is what I was looking for. So,
And lower
this
left.
tells me that per lip is present. Pupils are equal, round,
I heard normal vowel sounds throughout.
Alright,
while I'm here, I'm going to go ahead and auscultate your abdominal vessels, starting with the aorta.
I just want you to look straight ahead for me, okay?
Renal.
Your
And
red
cardiac.
reflex is present. Your obliques is creamy yellow, and your retinal veins and arteries are parallel, are visible and paired.
Abdominal arteries and veins were, abdominal vessels were good. I heard no
Check your
bruise.
neck muscles.
Now I'm going to begin
Now, what I'm
percussing.
gonna do is I'm gonna
Percussing 3 areas in each quadrant.
midline, and I'm also gonna
Going in
check
the
your
lower right again.
head back for me. Okay, so your trachea is midline. I'm gonna do this
Upper
head
right.
line here. What you do is lean your head forward and to the right. And as you
Cuss
swallow,
over the liver.
okay,
I
now
heard
lean your
dullness.
head forward and to the left.
Upper left.
Can you swallow for me? Alright, now, I didn't know any lumps or masses there. Your thyroid is not palatable. This is normal for your age.
I heard timpani throughout over the stomach and the intestines, and I heard dullness over the liver, which is normal. The next thing I'm going to begin is percussion. I'm going to percuss in 3 areas in each quadrant. Begin with light palpation. It's just a testing for pain, tenderness. Let me know if you feel any.
Okay, next I'm going to check your pulses.
No pain or tenderness?
No, ma'am.
Okay, now I'm going to move on to deeper palpation.
Check your pulses now. And your brachial pulse. Okay, 6 plus. And your radial pulse.
Let me know if you feel any pain or tenderness.
Check your south speed pulse. You should be fine. Flip flops on in. Check your south speed pulse is 2 plus as well. Now I'm going to check your posterior tibialis pulse.
Yeah. Take a deep breath in.
Okay, again, 2 plus. Now I'm going to check your carotid pulse, okay?
And another deep breath.
Alright, again, 2 plus.
Spleen and liver were not palpable. I didn't feel any swelling of any of the internal organs. And you said you didn't feel any pain or tenderness?
No, ma'am.
Very good. You can go ahead and sit up for me. And I do remember that I forgot to do 2 more things with your back. You can just turn your legs around for me. This first one is called tactile firmness. Every single time you feel my hands, I'd like you to say 99.
99. 99. 99. 99. 99.
The next one is diaphragmatic expansion. I'm just going to hold my hands here. I want you to take a deep breath. Okay, good. Both sides deviated by 3 to 5 centimeters, which is very good and normal. Or you can swing your legs back around. Next thing we're going to do is I want to assess your upper and lower extremity strength. You can hold your arms up like this. I want you to pull against me, push, and do the same for your legs. Pull, push. Very good. Next thing I'm going to do is I'm going to assess your pulses and your deep tendon reflexes. We'll start with pulses. This will be your brachial pulse. Brachial pulse is 2 plus. Radial, 2 plus. While I'm here, I'm going to go ahead and do your arm deep tendon reflexes. I want you to just relax your arm.
So, your heart sounds were normal. I did not hear any murmurs. You had normal S1 and S2 heart sounds.
That was your bicep reflexes. Now we're going to do your tricep.
Your S1 heart sounds are best heard at the base and your third.
Move on to your legs.
Anyway, move on to your
Feel your
S1 heart sounds are best
pulses
heard
of your
at
feet.
your
Oh, I'm sorry.
Just on.
apex and the S2 heart sounds are best heard at the base. Now we're going to move on
Dorsalis
to
pedis is 2 plus.
your lung sounds. Okay, so listen to your heart sounds. Now
Posterior
we're going
tibial is 2 plus.
to
On
listen to
here, I'm going to do your
lung sounds.
capillary reflex.
Begin with the chest.
Very good.
Okay.
I'm going to do your Achilles reflex. You might take me off one of your shoes.
No, ma'am.
Take a deep breath.
Right, very good. All of your reflexes were good. All of your pulses were all 4 2 plus. Once again, for the sake of this video, I'm only going to do it on one side for the sake of time. Okay?
Good. Had normal lungs.
So you would like we're going going to do a few range of motion exercises. First one we're going to do is your neck. Once you flex your neck back, or extend your neck backwards, very good. Extend your neck, or flex your neck forward. Let's do some lateral bending to the right, lateral bending to the left. Let's rotate our head to the right, and rotate our head to the neck, or rotate our neck to the left. Very good. Okay, I didn't feel any crepitation, any crackles in the bones. The next we're going to do is your shoulder. I want you to abduct your arm away, abduct it back. Very good. I want you to do some circumduction. Let me go on this side. Circumduction. Very good. I want you to do some internal bend, internal rotation by going behind your back like that. Very good. Now let's do some external rotation by putting your hands behind your head. Very good. I didn't feel any crepitation or hear any crackling in the shoulder. Full range of motion. Next we're going to move on to your elbow. I want you to extend your elbow out. Very good. Flex your elbow towards you. Can you pronate by putting your palm down? You supinate by putting your palm up. Once again, no cracking, no crepitation. If you'd like to stand up for me, we'll do some range of motion for the spine. So, I want you to bend down, touch your toes. Okay, that was flexion. Now extend back up. Let's do some lateral bending to the left, lateral bending to the right. Now can you twist around to the right and twist around to the left? Good. Once again, I felt no crackling and no crepitation. We're going to move on to your knee. If you will flex your knee up for me, you can brace yourself against my back. Very good. Now flex it backward. Right. So first was extension, that's flexion. That's very good. I felt no crackling or crepitation. Once again, for all these range of motion exercises, I'm only going to do one side for the sake of time. While I have you standing up, and I'll finish range of motion later, we're going to do a few coordination tests. The first one is going to be a romper. I'd like you to close your eyes and stand still, and I'm going to assess you for any sway. We would do this for 20 seconds. Okay, time is up. You're very good. I saw slight swaying, but that's typical. Next thing we're going to do is we're going to do a tandem walking. What this is we're just going to put our heels to our toes and walk forward 4 steps. 1, 2, 3, 4. Now let's back it up. 1, 2, 3, 4. Very good. Okay. I think we can sit down now. And I'm going to go ahead and do the range of motion on your ankles. Okay, the first thing I want you to do is I want you to press down on the gas pedal. That is plantar flexion. Then I want you to flex it up. That's dorsiflexion. Invert it, or do inversion by turning your foot inward, and eversion by turning it out. Okay, once again I do that to the other side. For now I'm going to consult my notes again to make sure I haven't forgotten anything before we move on. Okay.
Okay, now I did hear dullness over the liver and Tiffany over the stomach. These are normal sounds. That's good. We're going to move on. We're going to palpate your stomach. We're going to begin with a light palpation and then go ahead to a deep palpation. Now, all I'm doing here is I'm feeling for any lumps or masses, any organ distension or organ, and checking for organ plate. Okay? We're going to do a light palpation. All right, now got my light palpation. I'm going to go ahead and do a deeper palpation, okay? Now let me know if you feel anything, all right? Okay, now I'm not feeling any lumps or masses. Are you working so like everything is good there? So you can go ahead and sit up for me if you'd like. Oh, I'm sorry.
I didn't note that your thorax was symmetrical and elliptical, and the lateral ratio was 2 to 1. And when I auscultated the vessels in your abdomen, there were no bruits noted. I also didn't do capillary refill, so if you'll pull out your hands, I'm going to press down your nail beds, and I'm going to see how long it takes for them to turn back to pink. Okay.
waves or bruises there. It's a normal finding. Now you can sit up if you'd like. You can go ahead and put your shirt on too. So next, we're going to check your reflexes. We begin with your bicep reflex.
Alright, Ms. Kendra, I think we're done. I hope I didn't hurt you at all when we did any of our tests. Are there any questions or comments you'd like to add before we finalize this?
No, ma'am.
Alright, that was very good. And I hope not to have to see you back too soon.
Okay.
You have a great day.
You too.